Hi friends, do you know anybody who's been on an acid blocker for a long period of time, like over 4 years? There's a new study out from neurology in the journal Neurology, which is a really good study, and it's really nailing down some of the risks with long-term chronic PPI, protein pump inhibitor use, which are the acid blockers, the little purple pill, all of that. There are a lot of them out there, and people are taking them willy-nilly without thinking about it. And unfortunately, it turns out that there are multiple risks associated with them. So I'm gonna read from my notes because I want to make sure that I really get the detail across. First of all, increased risk of B12 deficiency, which apparently is not really helped by supplementation. And lower B12 status has been linked to cognitive decline in the past. So, especially for people with the genetic APOE4 allele or with people for depression. So, that's a really, to me, that's a no go. Don't do a protein pump inhibitor if you've got any of those markers. And the sad truth is that you're dodging a problem and creating a problem at the same time, when what we really want to figure out is, why are you having acid issues in the first place? The other deficiency that seems to be linked to early cognitive decline is lack of magnesium. And higher intake and longer term chronic use of PPIs also tends to leach out your magnesium. Now, the jury's a little bit out on whether magnesium supplementation is helpful here or not, but personally I'm a fan of taking magnesium because most people are deficient. So if you add a PPI to that, you're really getting a nasty twofer. The other thing that is really a critical factor is that PPIs, these protein pump inhibitors that block gastric acid, are also increasing your risk for stroke and myocardial infarction, i.e. heart attack and brain stroke. So those alone are not good things, and then you get possibly a link to chronic kidney disease. So all in all, I'd say if you know anybody who's been taking a protein pump inhibitor or any kind of acid blocker, whether with or without a prescription, and they're widely used in both directions, and not always with a GI diagnosis, by the way. Don't get me started on that. You really need to sit them down and say, look, this is not a good thing, and you want to look at how we can address what's driving the acid issue in the first place. Because the other nasty backhanded effect of these PPI use is that it tends to decrease the microbiome flora, and that is clearly linked to brain health. So if you want more information about this, or you want to have a discussion about what's going on with either your stomach or somebody you love, just DM me below and give me a heads up if you think this has been a useful video. Take care and talk to you soon, I hope.